May peace be on all of you. Myself, Dr. Majid Khan, Associate Professor, Luknete Dr. J.D. Pawar College of Pharmacy, Kalwan, Nasik. I welcome all of you in this new chapter, Autocoids. In that is in lecture 1, we will cover prostaglandin, about prostaglandin, in that their nomenclature, chemistry, biosynthesis of prostaglandin, and receptor for prostaglandins. Now let us start. That is learning outcome, student learning goal, nomenclature, physiological action of PG, that is prostaglandin, chemistry, biosynthesis of prostaglandin, and receptors of prostaglandins. So first, what do you mean by autocoids? Autocoids are the biological factors or molecule which act like local hormone, have a brief duration, and act near their site of synthesis. The word autocoid comes from the Greek autos means self and eikos means relief or drug. So autocoid means it is a self drug. The effect of autocoid are primarily local. Through large quantities can be produced and moved into circulation. So it is about the definition of autocoids. The autocoids may include eicosanoids. It may include prostaglandin, leukotrienes, thromboxane, etc. Now eicosanoid. The eicosanoid are 20 carbon fatty acid. Eco means 20 carbon containing compound. So these are the compound which contain 20 carbon fatty acid that are produced in variety of tissue and that mediated an array of physiological and pathological process. They consist of prostaglandin PGA through PGH, that is prostaglandin A to prostaglandin H, which are present in nearly in all mammals tissue where they regulate the function. So eicosanoid, the term means the compound which contain 20 carbon. So in that eicosanoid, the example is prostaglandin, leukotrienes, etc. So the main eicosanoid is prostaglandin. So prostaglandin, the eicosanoid, especially the prostaglandin, were discovered in 1935 when a Swedish physiologist and Nobel laureate Ulf von Euler and other investigators found that prostaglandin are the group of naturally occurring substance synthesized preliminary in the prostate. They has been first isolated from the extract of human seminal fluid and of vesicular gland of sheep. So prostaglandin, the name is given because it is thought that it is secreted or released from the prostate gland. Therefore, the name is given prostate or prostaglandin. So it is a one type of autocoid or eicosanoid. Now, physiological action of prostaglandin. The prostaglandin are the important mediator of normal physiological event and have been implicated in variety of pathologies. They have been implicated in inflammation, pain, pyrexia, cardiovascular disease, renal disease, cancer, glaucoma, asthma, male sexual dysfunction, etc. This leads to development of prostaglandin drug product. Prostaglandin effects are usually manifested locally around the site of prostaglandin synthesis, and their action are multiple and variable, which may be stimulatory or inhibitory, depending on the tissue type and the nature of receptor with which they interact. So there are a number of physiological action of prostaglandin. So these are the various actions. So first one is vasodilation. Prostaglandin are a powerful vasodilator that relax the muscle in the wall of blood vessel so that diameter become larger, and there is a less resistance to the blood flow. The important example of vasodilation effect of prostaglandin is in the kidney, where widespread vasodilation leads to increase in flow of blood to the kidney, increased excretion of salt in the urine. Thromboxane, on the other hand, are powerful vasoconstriction in same setting. Some diuretic like furosemide may act in part by releasing prostaglandin in the kidney. Prostaglandin inhibit the action of vasopressin at kidney tubule, resulting in enhanced excretion of water, leads to secretion of another kidney prostaglandin that stimulates secretion of renin. Renin stimulates production of aldosterone, which has effect of conserving sodium and water, this combating the dehydration and elevating the depressed blood pressure. So it is the first effect, vasodilation, that is sodium and water retention. Now second, that is control of gonadotropin releasing hormone and luteinizing hormone. So in female, prostaglandin modulate control of gonadotropin releasing hormone over the luteinizing hormone secretion, modulate ovulation, and stimulate uterine muscle contraction. This property has led to the successful treatment of menstrual cramp, that is called as dysmenorrhea, through the use of NSAIDs, non-steroidal anti-inflammatory, as an inhibitor of prostaglandin synthesis. Third one is, that is prostaglandin also play a role in inducing labor in pregnant women or in inducing therapeutic abortion. Next effect, that is thromboxane stimulate platelet aggregation, and fifth one, PG inhibition of platelet aggregation. So here the process of clot formation begin with aggregation of blood platelet, and this process is strongly stimulated by thromboxane and inhibited by prostacyclin. Prostacyclin is synthesized in wall of blood vessel and preventing needless clotting. Thromboxane synthesized within the platelet and favor the clotting. So through prostaglandin and thromboxane, clotting is prevented when it is necessary and takes place when it is needed. Platelet adhere in arteries that are affected by atherosclerosis. This type of platelet aggregation and clotting leads to blocking or occlusion of blood vessels wall, most common cause of heart attack. Therefore, aspirin is a COX inhibitor, preventing a risk for coronary occlusion in heart patient. Then next, that is luteinizing induction inflammation, leukotrienes induction of inflammation and mediation of pain signal. So here eicosanoid, especially leukotriene, play a role in inflammation process characterized by a redness, that is called as rubor, heat, that is calor, pain, that is dolor, and swelling, like that is tumor. These changes are due to local dilation of blood vessels that permit increased blood flow to the affected area. The blood vessel become more permeable, leading to escape of infection fighting fluid and WBC from the blood into surrounding tissue. Thus, the effective treatment to suppress inflammation but non-infectious disease such as rheumatoid arthritis is to treat patient with inhibitor of PG synthesis such as aspirin. Next effect is, that is immune response. The immune system protects from the invasion by bacteria, viruses, and other noxious agents. It begins when a foreign substance is ingested by mobile scavenging WBCs called as macrophage. The macrophage interact with special WBC T lymphocyte, that is T cell, which activate B cell, which secrete antibodies which attack ingested foreign particle. The T cell become activated at the site of damage and release protein called as lymphokines, which attract macrophages to the local area and stimulate them to ingest foreign agent. Prostaglandin attenuate the immune response by inhibiting T and B cell, but some PG, particularly leukotrienes, enhance inflammatory responses. Next effect is protection of stomach lining, called as cytoprotective effect, which is important. Prostaglandin are powerful inhibitor of stomach secretion gastrin, which stimulate gastric secretion. They also produce cytoprotective effect by enhancing gastrointestinal blood flow and mucus and bicarbonate secretion. It is not surprising that drugs like aspirin and other non-steroidal anti-inflammatory drugs which inhibit prostaglandin synthesis may lead to peptic ulcer. Prostaglandin action on digestive tract may cause severe watery diarrhea. And last one is stimulate resorption of bone. Prostaglandin stimulate resorption of bone. Resorption of bone means transfer of calcium from bone to blood. So prostaglandin stimulate resorption of bone in disease such as rheumatoid arthritis and to cause hypercalcemia. The hydrocortisone and prednisone stabilize cell membrane and block liberation of arachidonic acid. Anti-inflammatory steroid block production of eicosanoid by preventing release of arachidonic acid from phospholipid. NSAIDs block the COX, which convert arachidonic acid to PG. COX means cyclooxygenase enzyme. So NSAIDs block this COX enzyme, which convert arachidonic acid to prostaglandin. The leukotriene are also inflammatory agent. Drugs that block the enzyme that produce leukotriene are effective in treatment of asthma. So it is the main physiological action of prostaglandin in our body. Now next is nomenclature of prostaglandin. Prostaglandin consists of oxygenated cyclopentane or pentane ring. So it is a cyclopentane. Sometimes it may contain double bond, that is cyclopentane, with a heptanoic or heptanoic acid. Heptanoic means which contain 7 carbon, and octenol, which contain 8 carbon side chain on adjacent carbon. So if you see, it is a cyclopentane ring. Sometimes it may be cyclopentane ring with double bond. It is attached with 2 side chain. The upper side chain having the 7 carbon, that is called as heptanoic acid, or if double bond is there, then it is called as heptenoic acid. And this upper side chain is attached through the alpha bond, dotted, that is alpha bond. Then there is a second below, there is a side chain that is total 8 number of carbon with double bond, that is called as octenol side chain, which is attached through the beta bond to this cyclopentane ring. Then basic structural unit is referred as prostanoic acid. So this all structure, that is general structure of PG, is called as prostanoic acid. So in short, there are 3 components of this structure. First one is this cyclopentane ring. It may be saturated, it may be unsaturated. Second part, upper ring, that is called as heptanoic or heptenoic acid, alkane or alkene, which is connected through the alpha bond. Then below is octenol side chain, which contain 8 carbon and attached to this cyclopentane ring with beta bond. So each prostaglandin differ from another in the substitution pattern in the cyclopentane ring and the side chain, and these differences are responsible for different biological activity of the membrane of prostaglandin groups. Prostaglandin are broadly classified as prostaglandin A, prostaglandin B, prostaglandin C, prostaglandin D, E, F, G, H based on their cyclopentane ring or pentane ring substitution pattern. So depending upon this cyclopentane ring, prostaglandin are various type. It may be prostaglandin A, B, C, D, E, F, G, H. So there are various cyclopentane type of ring. So it is a ring A. It contains cyclopentane with double bond here on this position, double bond. Similarly, in case of B, double bond position is changed here. Then in case of C, double bond position is here. In case of D ring, there is no double bond but hydroxyl and ketonic group. Similarly, E, there is no double bond but here hydroxyl and ketonic group is there. F, 2 hydroxyl group is there. So it is a different type of cyclopentane ring A, B, C, D, E, F. So based on this ring, prostaglandin are A, B, C. If the structure contains this type of ring, then it is called as prostaglandin A. If it contains this type of ring, then it is called as prostaglandin B. If it contains this type of cyclopentane ring, then it is called as prostaglandin C, and so on. So depending upon the cyclopentane ring, prostaglandin is divided A, B, C, D, and so on. Each general prostaglandin class is sub-classified based on the degree of unsaturation. The letter and number that follow the initial prostaglandin abbreviation indicate nature of unsaturation and substitution. So as we see in the naming of prostaglandin, that is prostaglandin A1, prostaglandin E2, prostaglandin F2. So here the prostaglandin means A means which contain A type of cyclopentane ring, and the number that is prostaglandin A2. So here 2 means number of unsaturation in side chain. So for example, if the compound contain D type of cyclopentane ring and it contain 2 double bond in side chain, then it is called as prostaglandin D2. So number of double bond indicate the number in the name of prostaglandin. For example, so if you see the structure, here the cyclopentane ring, here the cyclopentane in A type. So it is a A type cyclopentane ring, and here the side chain contain 2 double bond. Therefore this structure is prostaglandin A and this 2 double bond. So it is a structure of prostaglandin A2. Similarly, next example, here this type of ring, if we see the ring, this ring, that is, it is a E type ring. So here there is a E type ring. This one is E type ring. So therefore it is a prostaglandin E, but it contains 1 double bond in side chain. Therefore it is the structure of prostaglandin E1. So by this way the nomenclature of prostaglandin or the name of prostaglandin is given. So depending upon the types of cyclopentane ring and depending upon the number of double bond in side chain, the name is given for prostaglandin. Then chemistry of prostaglandin. So it is the important point of some chemistry of prostaglandin. First point, prostaglandin have common structure based on prostanoic acid which contain 20 carbon atom. Second point, they are separated into the 4 groups A, B, E and F depending on the variation in double bond and in the hydroxyl and ketonic group. The carbon chain are bonded at the middle of chain by 5-member cyclopentane ring as we seen in nomenclature. D point, prostaglandin A, B and E have oxo group, that is ketonic group, at position 9, whereas prostaglandin F has hydroxyl group in this position, that is position 9. So here A, B, E prostaglandin having oxo group on 9th position, whereas the prostaglandin F has hydroxyl group on 9th position. Next point, prostaglandin A has double bond between position 10 and 11, whereas prostaglandin B has double bond between the position 8 and 12. So prostaglandin A having double bond on this position 10 and 11, prostaglandin B has double bond on 8 and 12 position. Prostaglandin E and F do not have double bond in the ring, but it possesses hydroxyl group at position 11. Next point. All active prostaglandin have at least one double bond between position 13 and 14. Some have 2 double bond, the second double bond between the 5 and 6. And some prostaglandin have triple bond, 3 triple bond, the additional bond being between the 17 and 18. So some prostaglandin may contain single bond, double bond on 13 and 14 position. Some prostaglandin may contain 2 double bond, some contain 3 double bond. The next point, the common single bond has the trans configuration, where the other double bond have cis configuration. Next point, all prostaglandin have hydroxyl group at position 15 and some have another hydroxyl group at position 19. So may contain hydroxyl group on 15 position or it may be on 19 position. So it is about the main point of chemistry of prostaglandin. Now next point is biosynthesis of prostaglandin. So the key precursor in eicosanoid biosynthesis pathways is arachidonic acid that is formed from linoleic acid through reaction catalyzed by series of enzymes that dehydrate fatty acid. Cells stores arachidonic acid as a component of membrane phospholipid. In response to appropriate stimulus, arachidonic acid is liberated from the storage lipids by the enzyme phospholipase A2. Conversion of free fatty acid to prostaglandin and other eicosanoid is initiated oxidative enzyme of cyclooxygenases, also called as prostaglandin synthase and lipooxygenases family. So there are 2 types of pathway in prostaglandin biosynthesis. First one is COX pathway and second one is lipooxygenases pathway. So first one is COX pathway. So it is the enzyme. COX means cyclooxygenases enzyme, also called as prostaglandin synthase enzyme. So prostaglandin is biosynthesized by 2 pathway, or eicosanoid is biosynthesized by 2 pathway. First one is COX pathway, that is cyclooxygenases pathway, and second one is lipooxygenases pathway. So in COX pathway, COX added 2 molecules of oxygen to arachidonic acid to form bicyclic endoperoxide prostaglandin G2. Then this prostaglandin G2 reduced by COX to yield prostaglandin H2. This prostaglandin H2 serves as a branch point for specific enzyme leading to formation of prostaglandin D2, prostaglandin E2 and prostaglandin F2, etc. So COX pathway consists of 2 steps. First step is the formation of prostaglandin H2 through the prostaglandin G2 formation. So it is a starting material, that is arachidonic acid. It is a arachidonic acid. Here the first step, oxygen is added, 2 molecules of oxygen is added. So here oxygen attack here, this bond shifted here, so it formed this type of structure. So then step 2, this oxygen attack to this carbon, this pi bond attack to this carbon, there is a formation of bond between these two, there is a 5-member ring formation. Then this double bond shifted here, and this pi bond attached to this again oxygen. So here 2 times oxygen is added, and then protonation simultaneously. So it formed this type of product, which is called as prostaglandin G2. It is a prostaglandin G2. Then there is a reduction. Reduction means there is a just removal of this one oxygen, so it become OH. This structure is prostaglandin H2. So it is the first step in Cox pathway, that is a conversion of arachidonic acid into prostaglandin H2 through the formation of prostaglandin G2. Then this H2 further in step 2 converted into another type of prostaglandin. So it is a product of first step, that is PgH2, prostaglandin H2. Here there is a hydrogen is added, this bond is break, one hydrogen is added here, one hydrogen added here, and this bond is break, so it become OH. Then from this OH, one hydrogen is removed and bond shifted here, it become double bond, that is ketonic bond, like this. So there is a formation of PgD2. It is a PgD2. Similarly here in this there is a again hydrogen added, this bond is break, then it is PgF2. Then next here same reaction, but here the opposite, here the ketonic bond, here the OH bond, it is called as PgE2. So from PgH2 there is a formation of PgD2, PgF2, PgE2, and number of step, after number of step it also form thromboxane. So it is another type of eicosanoid. So it is the first pathway, Cox pathway, which involved 2 steps. First step, a conversion of arachidonic acid into prostaglandin H2 through the formation of prostaglandin G2. Then step 2, prostaglandin H2 converted into another type of prostaglandin, that is D2, F2, E2, and thromboxane. The next pathway, that is lipooxygenase pathway. So enzyme here is lipooxygenase. It also involved 2 steps. There is the first formation of leukotriene A4. It is a leukotriene A4. So here again starting material is same, that is arachidonic acid. Here again oxygen attack here, this bond shifted here like this. Then here there is a removal of water molecule. So here there is a arachidonic acid converted into this compound, that is called as HPETE, full form hydroperoxy eicosanoic acid, that is HPETE. Then after removal of water molecule, how water molecule is removed? So see here, hydrogen is removed here, then this bond attack to this oxygen, OH is removed, so there is a formation of 3-member ring like this, and here there is a shifting of bond like this, so it forms leukotriene A4. Again this compound, that is HEPTE, after reduction, that is removal of oxygen only, it forms HETE, that is hydroxy eicosanoic acid. So here in step 1, conversion of arachidonic acid into leukotriene A4. Then in step 2, leukotriene A4 converted into another type of leukotriene, that is B4 and lipoxene. So here there are 2 product is formed. So here first water molecule, here see first reaction is blue by indicating the blue figures. So here water molecule attack to this carbon, this bond shifted here, this bond shifted here, this bond shifted here, and there is breaking of this bond, that is blue line bond. So it formed this type of product, leukotriene A4. Same here on red side, hydroxyl group attack here, this bond shifted here, and here again there is a OH attack here, and this bond is break. So you get this type of product, that is lipoxene or lipoxene 4. So lipoxene's pathway consists of two steps. First is formation of leukotriene A4, then this leukotriene A4 converted into B4 and lipoxene. So it is about the biosynthesis of eicosanoid, which consists of two pathway, COX pathway and lipooxygenase pathway. Then PG receptors. Prostaglandin receptor or PG effect are usually manifested locally around the site of prostaglandin synthesis, and their action are multiple and variable, which may be stimulatory or inhibitory depending on the site, depending on the tissue type and nature of receptor which they interact. Up to date, 8 prostaglandin receptors have been cloned and characterized. Note that these receptors are coupled to either phospholipase C or adenyl cyclase as a secondary messenger. And in case of adenyl cyclase, the action of prostaglandin may be stimulatory or inhibitory. So there are total 8 prostaglandin receptors are identified, and all these receptors are in secondary messenger is phospholipase C or adenyl cyclase, that is cyclic AMP concentration. So here in this table various receptor is given called as EP1, EP2, EP3, EP4, FP, DP, IP and TP. So here the name is given. Here E means which type of prostaglandin is attached to this receptor. For example, EP1, so here prostaglandin E react or attached to this type of receptor. Again EP2 means here E means prostaglandin E. So these 4 receptor, that is EP1, EP2, EP3, EP4 is for the prostaglandin E. Similarly, FP receptor is for prostaglandin F. Similarly, DP receptor is for prostaglandin D. IP receptor is for prostaglandin I. TP means it is a receptor for thromboxane. So these are the receptor type. These are the ligands which prostaglandin interact with this which type of receptor. And there is a secondary messenger. So again here there is a 2 secondary messenger, phospholipase C or it may be adenyl cyclase. So these are the signaling pathway of prostaglandin on their receptor. So it is about the prostaglandin receptor. So in next video, that in lecture 2, we will cover SAR of prostaglandin and clinically approved prostaglandin analog and leukotrienes. So if you like this video, then subscribe the channel. Thank you very much.